going on, which is sale on the internet. About a year and a half ago, we got an intelligence about an anti-cancer drug that is falsified, that is on the internet, being sold on the internet. We use a lot of intelligence in NAFDAC. We follow them to the southern part of the country, and we apprehended. Again, like what Registrar was saying, you see the front end, you don't know what is in the back end. And the fact that there must be pharmacists to sell, which is part of PCN's mandate, that pharmacist was handed over to PCN. For discipline. We have our own appointment promotion disciplinary committee of our council. PCN has something similar. Because that pharmacist either debarred or suspended or whatever, because they cannot use the internet to be endangering the lives of our people. It is a progressive thing and it's global. It is kind of invisible. But like the registrar said, we have intelligence that will shut them down. There is a training that is going to happen, I think September, on chemometrics. And part of it is trying to train our staff to the new technology that can track and trace these internet sales. So that is about that in terms of internet, social media. You asked a question about GMO. I was at Channels, I believe, last week or so. Many years ago, before I came back to Nigeria, we were in Florida. And we saw tomatoes being cultivated in plants, your plant buckets or whatever, that can grow faster. Not all GMOs are bad. Some are genetically modified to produce more. Some are genetically modified to resist insects, whatever, spoilage. 70 to 80% of our raw produce in Nigeria gets spoiled because we don't have good storage condition. However, that doesn't mean we close our eyes to GMO, because in science you have boundaries. The National Biosafety Agency, Management Agency, which we collaborate with, is in charge of making sure that any food that has GMO or that is developed or produced by GMO technology, they will certify. Without that, we cannot approve. And it has to be on the label. It's not like, those days, they will just put one generic name or word to make sure people don't understand what is going on. Now you have to put it genetically modified X product. We have the labeling. We just got that approved, regulation in 2022. We have post-marketing surveillance. But the collaboration between NAFDAC and the Biosafety Management Agency should assure us that we have two agencies working on one product. It's not all products that are genetically modified. If you go to advanced countries, you will see organic, meaning there was nothing in that soil, whatever. About 80% of others are not organic. They are safe so long as the agency that is supposed to make sure of that safety is doing well. and they work collaboratively with us. I was talking with somebody this morning. Medicine. If this is a theater, a surgical room, a surgery can take place here, and it will be done through telemedicine from New York, Chicago, or wherever. There are advances in science. But if that advance is not within the confines of what is good for the public, then there's a problem. People have said that the ginger in Nigeria is not yielding the same. I'm not an agric person. I want to see data. Why is our ginger that used to be the best, they said it's no longer the best within 2 years? Scientifically, it's difficult for me to understand that. It will take maybe a decade, because the soil just doesn't wake up one day and say, I'm not going to support this, unless something was rained down on that soil to destroy it completely. So it is all about, and we can Google it also. There is nothing that's about GMO that you cannot find on Google. But for us, we make sure that foods that our people take are foods that will help, that will make them well, that will not cause any adverse effect or do anything to their genetic disposition. I hope I answered that question. Incomplete accounting. Incomplete accounting. In terms of our enforcement in the 3 markets.
I am the Registrar and CEO of Pharmacy Council of Nigeria. We are very pleased with the outcome of the report of the re-benchmarking of the National Regulatory Agency in Nigeria, where in this case, NAFDAC and Pharmacy Council of Nigeria were key players in the process of benchmarking. Indeed, it was a very rigorous exercise. It was an exercise that was put out to ascertain whether the standard we use for the regulation or the pharmaceutical landscape, which of course the ultimate product is the medicine, actually aligns with global standards. And we are happy and pleased that indeed it's found to be so.
Yes, it was found to be so. These follow-up sessions review the progress made by NAFDAC and Pharmacy Council of Nigeria in these sessions review the progress made by NAFDAC and the Pharmacy Council of Nigeria, PCN, in implementing key recommendations necessary to successfully complete the REACH benchmarking process. The closure, and I will ask Babashewu to also chime in now, the closure of all critical recommendations marks a major regulatory milestone for Nigeria, reaffirming that NAFDAC operates and PCN operates a stable, well-functioning and integrated regulatory system for medicines and vaccines. Please, you can jump.
Indeed, the process, like I said earlier, was very tedious. One, the tools we use for regulation were evaluated from the instruments like the laws, the regulation, the guidelines and the standard operating procedures that we follow to undertake inspectorate activities were critically evaluated. The quality management system in the process was also evaluated, and indeed, the CAPA or the outstanding gaps were found to have been closed.
Thank you. Just to make sure that people understand what are the areas that, and I will give examples of what WHO was looking at. These areas include the regulatory system. Where we are right now is part of what they look at. The environment, the number of staff, the number of computers, the number of vehicles, the tools that you need to use to make regulation effective. That's regulatory system. We call it RS. Another function that they looked at, part of, it's actually 9 functions. It's market authorization. We call it MA. It has everything to do with registration of products. We also have market control, MC. That market control is all about making sure that what is in the market is what is supposed to be in the market, which means it's what the patient or the consumer is supposed to have. And if not, how do you control it? Another one is lab testing. You cannot do anything without testing of some of the pharmaceuticals or medical products. Another one is regulatory inspection. This is where we are joined. PCN and NAFDAC are joined at the hip. Because PCN inspects sites. First of all, they give license to sites. If they do not give license to sites, we cannot do anything with that site. They also, aside from industry, they also license practitioners. For us, the regulatory inspection, we do good manufacturing practice inspection in the industry, and we do good clinical practice at the clinical sites, and we do good storage and distribution practice at the various distribution centers. These are just examples. License establishment is for PCN. And that's what I just said, that they have to site license before we can go there to do good manufacturing practice and other things that we do with industry. So, this May 25 exercise, when they came back, NAFDAC and PCN were found to remain the first national regulatory authority in Africa to maintain, to sustain. We are not the first regulatory agency in Africa to get maturity level 3. Tanzania was the first. Second for medicines. Second was Ghana in 2022. Tanzania, I believe, was 2020. Ghana was 2022. Ghana is 2020. I think Tanzania is 2018. And Nigeria was 2022. But we are the first to be re-benchmarked and found to have sustained and to have maintained that status. This underscores the agency's leadership and excellence in regulatory oversight across the continent.
Indeed, what this means that the two agencies were benchmarked together, recognizing the fact that there are areas specific to each of these agencies, is to see and ascertain the effectiveness of communication.
Yes.
Because the two agencies cannot play in the same field, wherein there is no communication or effective communication, wherein what happens at one end cannot be supported or guaranteed or assured to be right from the other side. What it means is that we have standards that are agreeable, that we compare not. What it also means is that what individual agencies have responsibility to do, we are doing it very right. And that is why we can compare not and find them to be supportive of one another.
This exercise has taught both agencies a lot of lessons. How to collaborate, how to communicate. We have what is called the communication matrix. which Alhaji Babashehu just mentioned. Meaning, when NAFDAC needs to know something about what is going on with a facility, we have to talk with PCN. When PCN wants to relicense, we have to share what we have found within this year or space with PCN. It is all about Nigeria. It is not about NAFDAC. It is not about PCN. We have learned that lesson of collaboration. And the achievement reflects the unwavering dedication, technical expertise, and resilience of all NAFDAC staff and PCN staff nationwide. I saw Dr. Amina. Dr. Amina is one of the senior people in PCN. We met, when was the FTF? Friday. Yeah. And I just said, I salute you. Because we were grilled. Both agencies were grilled. It is not African standards, it's not Nigerian standards that we are trying to follow. It is international standards. There was no reservation about what WHO can ask us, because global benchmarking is comparing us with the best in the world, not comparing ourselves with ourselves. That is why it is very, very significant. Before we got the maturity level 3 in 2022, we had 267 sub-indicators, what we call sub-indicators or requirements, so to say. And each requirement may have 1 or 2 or 3 recommendations. The recommendations total over 800 as of 2018. And we needed to meet the requirements. It was a growth process for the two agencies. As a maturity level 3 country, we can manufacture vaccine. There is no country that should manufacture vaccine without maturity level 3. Because if you don't have international standards, what are you going to manufacture? Where do you start? That is where the collaboration between PCN and NAFDAC came in. It has made us stronger in the world. I'm talking of in the world, Nigeria. When Nigeria talks at any regulatory agency meeting, people listen. That is what we want for this country. For us to be respected, because God has given us that endowment. We don't want to bury it. Registrar.
Indeed, what we are doing today is hallmark of responsible leadership. What that means is when a responsibility is placed on an agency, it goes beyond looking at individuals. It also goes beyond looking at the agency. You look at the country as a whole, because the agencies were created to serve Nigerians. And that is why, in the wisdom of the drafters of the law, the chairman of the Pharmacy Council of Nigeria Governing Council is a member of the Governing Council of NAFDAC. The Director General of NAFDAC has also been recently, because it ought to have been long before now, but in the course of this collaboration, it became very obvious. Director General NAFDAC is also now a member of the Governing Council of the Pharmacy Council of Nigeria. What this means is that where strategic policies, directions are made, these two bodies are together on the table. Yes. Because they are not just being made for the agencies, they are made for Nigeria. And the two agencies play critical roles in this particular pharmaceutical landscape.
Thank you. Okay, I know you're going to have questions. but we just got re-benchmarked. Is that it? No. We are going to level 4. I mentioned that for level 3, we had about 267 sub-indicators. For level 4, we have 57 indicators. We have already closed 27 of them, because as we go along, we do XYZ. If it is maturity level 4 indicator, we close. So we have about 30 indicators left. We have already started working again. Why? Because of Nigeria. Why? Because we can. Why? Because it is important for the image of this country, to whom much is given, much is demanded. God has given us so much, maybe too much. Just like I said, we don't want to bury it. That is why PCN and NAFDAC are working day and night. First, to ensure that the medicines that our people use will not kill them. Public health. Secondly, to ensure, because after maturity level 4, there's what is called WHO listed authority, WLA. There are some countries that are called stringent regulatory authorities. Health Canada, US FDA, Australia FDA, European Medicine Agency are examples of those that belong to stringent regulatory authority, SRA. When we get to WLA, we become stringent regulatory authority. We join them. Products that we approve after that date can be sold